Among the many challenges facing the country's healthcare system, language barriers when patients and providers speak different languages. In collaboration with the Global Health Reporting Center and with support from the Pulitzer Center, William Brangham looks at how nurses are meeting the moment. It's part of our series, Critical Care, the Future of Nursing.
Julio Orellana speaks no English and received medication from a pharmacist who spoke no Spanish. He didn't know what the medication was for, and so he hadn't taken any.
Okay, let me see the pills that you have.
Nurse Cristina Melgar tells him how to take it and offers a little encouragement.
Of course, if you have any problems, you know you can come here.
Melgar says, in addition to providing medical care, traversing these language barriers is a crucial part of her job.
So the system is rough for patients who are not fluent in English. They feel neglected, they feel not treated with respect sometimes.
Melissa Marin Larena oversees the nurses here at La Clínica del Pueblo, the Clinic of the People in Washington, D.C. Most of the staff speak fluent Spanish, something she says is a critical part of delivering top-shelf care.
There is literature out there, and that backs up the fact that patients want to be taken care of by providers that look like them, that speak the same language as them, and by providers that sound like them. And unfortunately, right now, there's not enough of us out there.
Most clinics and hospitals are legally required to provide interpretive services based on the Civil Rights Act of 1964, and the rule was strengthened in the Affordable Care Act.
Okay, le voy a dar 2 paquetitos ustedes.
While communication is just one of many factors that affect the quality of care, studies show that language gaps on their own can lead to worse outcomes.
Anytime you have a harmful event happen to you in the hospital, those harmful events, the risk for people who with limited English proficiency can be 15 to 25% higher than people who speak English.
Allison Squires is a professor of nursing at New York University. She studies what happens to patients who don't share the same language as their providers.
So they are at higher risk for experiencing a harm during a hospitalization. They are less likely to get timely access to primary care. They also are more likely to have a longer length of stay. So all of these things actually add up in terms of overall healthcare costs to the patient, to health systems, to insurance companies, everything.
Squires published a study of more than 90,000 patients who were released from hospitals with follow-up care back home. She found those with limited English were more likely to end up back in the hospital, only 1%, but still.
I know 1% doesn't sound like a lot in terms of an increased risk, but that 1% can compound into millions of dollars, especially if you're serving a lot of patients over time.
The Hispanic population is growing 3 times faster than the U.S. population as a whole. About 14% of the U.S. population speaks Spanish at home, and yet only 6% of working nurses are Hispanic.
It's all very different, and understanding, yes, the different dialects in Spanish, the different accents in Spanish is very different as well. What we are doing here at La Clínica is just a drop in the bucket.
Good morning.
The challenge isn't limited to just Spanish. About 1 in 12 Americans speaks limited or no English. 3 in 5 are Spanish speakers. The rest speak Chinese, Tagalog, Vietnamese, Arabic, and other languages.
50-something years.
At the Cizik Nursing School at UT Health Houston, they are making it a priority to build a workforce that better matches the patient population.
Okay, I have a friend, find a pair and go find a bag so you can...
Erica Yu is a professor and associate dean.
47% of our undergraduate nursing students are underrepresented minority, and our total student percentage is 46% of our total student. That means including graduate students are underrepresented minority, and 35% of our students are Hispanic, which is very different from the national picture.
Just open up your kit like you're going to put an IV in.
Professor Elda Ramirez, who is also a nurse, saw in the ER at another facility an awful example of what can happen when patients cannot be fully understood.
And I kept seeing this young woman And I could see that she was curled up in a chair and she was holding her face, and I saw in the chart that she had facial trauma, and I thought, oh, well, they're surely getting some imaging or whatever, and I looked at the chart and there was no imaging ordered. So I went up to her, and when I actually went up to her and said, perdóname, ¿qué está pasando? And she immediately says, químicas en mis ojos. She had chemicals that had splashed in her eyes. And somehow in the translation that had taken place at triage, that had been completely missed. I'm like, ooh. And then we were able to move forward. Luckily, she was okay, and we were able to take care of that. But that moment of time where that was missed in translation, that was huge. It was huge.
When there's no nurse or doctor who speaks a patient's language, the job falls to translators. Like here with this patient who's recovering from a stroke in the ICU at Houston Methodist Hospital. Erin Mulper oversees translation services at Houston Methodist. She says it's more than just language fluency. Translators also need some medical fluency.
They have to be certified. So there is medical terminology certification that goes along with that to make sure that patients are receiving accurate language interpretation.
So that if I say insulin or I say mastectomy or all the terminology is... The hospital has in-person translators who speak Spanish, Mandarin, and Arabic.
We also provide video remote interpretation.
So that person who might be doing the translation could be anywhere, basically, someone you've contracted with. But even though technology helps, it raises new hurdles and new questions. What if a patient just wants to go to the bathroom or to call a family member?
Do you call an interpreter every time someone needs to communicate that type of need? How can we effectively address those types of situations?
Nurses say literal translation is not the only goal.
And sometimes, especially with the aging population, that they may not be able to trust nurses when you don't understand their culture. So I think language, a lot of time, it comes with the culture.
Back at La Clinica, Melissa Marin La Reña says there's no real substitute for a direct personal connection. What do you say to the devil's advocate who would just say, Google Translate does all this for you?
Google translates, but it doesn't interpret. Those are two very different things. There's nuances to when somebody says something, when they speak, it's understanding how someone grew up. And again, it's more than what somebody is saying. And I think it's hard, you can't teach somebody to be bicultural, right? Like, that's how you grow up.
And you really do think that matters in the end?
I do. I think it makes a big difference.
She's going to help me understand you better.
There isn't good research comparing outcomes with in-person native speakers versus translators, but there's no question patients appreciate talking to someone who truly understands them.
Okay, and then
For the PBS NewsHour, I'm William Brangham in Washington, D.C.